Hi, I'm Natalie, the Nurse Manager at Cat Specialist Services, and we are just going to go through a little bit on pain scoring based on, I guess, the feline grimace scale, which we use a lot here at Cat Specialist Services. So, cats are very good at hiding their pain symptoms, so often the signs will be really subtle, and unless you're looking for them, they'll often go missed. Because of this, and because cats like to hide their pain, they do notoriously get under-analgesed as well. So we want to make sure we're, taking note of our patients, always doing a bit of a pain score. We do them routinely about every 4 hours for our patients in hospital, just to make sure we're keeping up on any potential pain that they may have. So the good thing about the feline grimace scale, so it got released probably about 5-6 years ago, and there's now an app as well, just to make it really easy for nurses, vets, owners, just to keep an eye on their cat's pain score. So the feline grimace scale is actually based on an acute pain setting rather than a chronic pain setting, so really good for those cats who have just undergone surgery, or they may be having, illnesses that are uncomfortable. And so, yeah, basically it's a really good thing to keep an eye on. Another one of the pain scales that we do use as well is the Glasgow composite pain scale, which is again also for acute pain, but goes through a bit more sort of their vital signs. So often at Cat Specialists, we do use this predominantly, but we also take in aspects of the Glasgow composite pain scale as well. So the feline grimace pain scale, this is a fact sheet that's actually on their website, and it also has little QR codes down the bottom that helps go through how to assess your patients based on this pain scale. So basically, it's a score out of 10, and there's 5 different areas that we do keep an eye on for these guys in order to assess their pain while in hospital, or if you're going to tell clients to monitor at home. They will become a 0 to a 2 depending on the position and the action items of these different pain categories. So what you basically want to do is you want the cat not to really notice that you're assessing them, because generally as soon as a cat is aware that you are watching them or they're aware of their surroundings, they will often go back into hiding those subtle signs as part of their fight or flight response. So with the feline grimace scale, the first thing we sort of look at is their ear position. So if they're nice and upright, which as you can see, Moriarty does have nice upright ears here. The next one down, they go slightly further down, which is then a 1, and then further down is your 2, which is your most painful score. Next, from their ears, we're looking at their eyes. So you want their eyes to be nice and wide, which is a 0, which shows sort of no pain or mild. And then we go into sort of eyes that are starting to shut, and then it leads into eyes that are very closed or squinty. So the squinty eyes tend to lean towards a 2 for this particular pain category. From there, we're looking at their muzzle. So you want to see if their muzzle is nice and relaxed. As soon as it starts getting a bit tense or sort of pushed back, that's when we start getting the scores of 1 and 2. And then we're looking at their whiskers, so the whisker position. So you want them to be nice and relaxed on their face. Once they start getting a bit straight and coming out of there, so as you can see, Moriarty's are nice and relaxed. Once they start becoming a bit more straight, that becomes a 1, and then when they're sort of splayed out, that becomes a 2. Finally, we want to look at their head position. So generally, comfortable cats or cats who are only in very mild sort of pain, they'll have their head above the shoulder line. So this would be similar to Moriarty here, heads up here, shoulders are down here. As their pain score increases, so the head will start becoming more aligned with their shoulders, and then for the highest pain score, the head will actually be below their shoulder line. So it's often those cats that you'll see in their cage, and they're just quite low, quite flat, pretty much want to be in the corner and not wanting to interact at all. Those are the ones that we should generally definitely assess analgesia in. With the feline grimace scale as well, so a pain score of 4 out of 10 and above, we should be reassessing analgesia, whether they're on it, whether we need to increase it. Just a 4 out of 10 is when we're sort of thinking maybe they're not comfortable enough. And then from there, after you've provided them with analgesia, then you can reassess them depending on what drug you're giving them. Will help decide how frequent your reassessment should be, and when you should be incorporating other modes of analgesia as well to make them more comfortable. So feel free to have a look on their website. Also, the app is in all the app stores, and generally start trialing it out on your patients in clinic. And I'm sure the cats will very much be grateful for it when we're keeping their pain under control. Obviously, if you have any questions or concerns or want further information, please reach out or also have a look at our website.